basically. Okay, so everyone they are going to look forward to the same concern of under risk. Okay, as well clinical research is also we have learnt it. Basically, majority of the doctors who have been appointed, their concern is such like my duty is to look after about my patients. I never bother about research. That's the kind of mentality will be there. Okay, as a management people, you have to give that psychological treatment to those people who have to get involved into clinical research. That's the thing what we have discussed in the previous session. Okay, yeah, still I'm getting a audio of many people that has to get mute. That has to get mute. Okay, so fine. It's about marketing of healthcare services. See, when we are going to look forward into the concern of marketing of this healthcare services, obviously the same 7 P's we are going to learn. Okay, so we are going to start considering about your hospital packages, what you're going to offer, number of beds available, specialists available, however you are going to make it up. That's going to be the concern of product. And come to the price aspect. Yes, we do have two different aspects. One, it is about government hospitals at the cost of free of service, and private hospitals, they are going to charge something. Okay, so when we are ready to charge something, when we are ready to make a move towards a betterment of our service, obviously the question will come like how and what kind of services we are offering, what kind of specialized services we are offering. That's going to be the major concern. So come to the concern of promotion activity. A number of promotion activities, as like other businesses activities, we are going to look forward and we are going to continue with the same amount of promotion activities as like the same services which are involved in the routine. Okay, TV, newspapers, and other publicity. So completely the same amount of activities. And come to the place. Place is the aspect. Now question comes that, so do we need to do any kind of homework in understanding geographically? That's the question of some of the BBA graduates. Yes, the answer should be as like, see, try to understand what kind of a specialist activity you are trying to offer, as like maybe eye specialist, hearing specialist, or else maybe concerned with many of these general hospitals. Whatever you're trying to offer, try to look forward into the concern of that geographical space, that geographical aspect. Okay, so what is exactly the need of those people? Try to understand, then you can able to execute anything. Okay, see, maybe in case if I'm going to take a simple consideration, you're trying to open up one of the eye hospital in one of the taluka place, assumption. Okay, which is having somewhere around 1.5 lakh of population. In 1.5 lakh of population, probably you may get hardly around 10 clients in a month period of the time. Is that sufficient revenue when you're going to run this kind of business activity? When you're going to move on to a district place in the sense, at least you can go for finding out some 30 lakh people very easily out of the complete district, very easily. When it comes to a city like Bangalore, around 1 crore population. How much ever the population is going to get increased, obviously based upon that particular place, based upon that locality, maybe you can go for getting number of clients more and more. You understand everything clearly? Okay, so it is all about how you are going to look forward geographically. And now come into the place and people. People, obviously your employees only, no one extra associate here. As we have discussed in a hotel industry, or else maybe a food packaging industry, or else maybe ITES jobs. As like the same here also, it comes into the same segment. People, employees. Doctors are your employees. Okay, so that the clinical staff is your employees. Maybe people who are all associated into that X-ray, or else maybe that particular extra services what they are offering, those people are your employees. Maybe in case if it is a large scale hospital with more than 300 beds, obviously that's a large scale hospital. So into that large hospitals, canteen facility will be there. Are you looking forward into that hygienic aspect of that particular canteen facility? Are you taking care of every employees who are all associated? Maybe on a rotation basis, doctors and nurses are going to get changed in those large scale kind of hospitals. Once in 8 hours, once in 10 hours. Maybe those doctors and nurses are going to get changed. Whether they are showcasing the same cope-up mentality with those patients. Correct? So people is most important. Most of the time, it is at more risk. Reason behind that, mistakes may get happen regularly. When the rotation is there, when the caretaker is not same, obviously mistakes may get happen. For that, what exactly the solution? Solution is such like how you are trying to create accountability. Sir, what kind of accountability in hospital services I can go for making it, sir? Make a record. Okay, so try to maintain a record file where other person also can able to access into that, and other person also can able to read that, and other person also can able to look for what he has written and how he can able to understand how he can convey that message. You understand the theme clearly of this accountability in the hospital services. Okay, so most of the time when you are going to maintain the record, that has to be visible to those patients and even the caretakers of that patients. Then only the satisfaction can able to get generate. Okay, so even furthermore aspects as like a process. Yes, very much so. It's a consolidate aspect of product, price, place, promotion, people. The same 5 P's is 6th P. So ultimately what we are expecting, customer satisfaction. Are we offering that customer satisfaction is the question. In case if it is yes, everything is yes. Okay, so even with the concern of physical evidence, beds will be there, medicines you will be providing, maybe you're maintaining the file, what I was discussing, the accountability concern, you're maintaining the file. Okay, so everything is acting as like a physical evidence. Is that done? Thank you. My work is done, and the extension of this hospital services we will discuss in the next session. Okay, so now let us move back to that attendance thing and wind up the aspect. But assignment, kindly submit the assignment by now itself, everyone. Okay, yeah, let us move back from the initial stage. Whomsoever I have marked present, just I'm deleting their names. Okay.
Why, sir? I'm present, sir.
No, look into this heading. Look into this heading. What is heading?
Absentees list.
Correct. So the present students I need to delete. Okay.
Okay, okay, sir. Okay,
please
sir.
do the cross check whether your name is being deleted or not. Okay.
Okay,
yes.
sir.
Yes, sir.
Okay, so clever, sir.
Okay. If I have not deleted anyone's name, please tell me so that I can delete. Please do the follow-up.
Satyaprakash, sir.
Hey, whether your name has come, Satyaprakash, please look into that screen, man. Okay.
Sir, not visible.
Sir, the screen is not.
I can't see. Blank.
Cannot. Wait.
Only Vishnu Vardhana is.
Wait.
Scroll the screen, sir.
Just one moment.
Only Vishnu Vardhana. Yeah.
Wait. One more time.
Everything
Just
is visible.
चलते खाना खाने नाले के अंदर
yeah. Is that screen visible now?
Yes, sir.
Attendance
sir.
screen.
Yes.
yes
Yes. Fine. And I'm deleting
My
the
name
names of
Emmanuel.
whomsoever they are present.
37.
Emmanuel.
Sir.
एक मैडम मेरा अटेंडेंस ले रहे हैं
Yes. Anyone's name is there to delete?
Sir, my name Amulya.
Wait. Whether Amulya's name is supposed to be deleted?
No, sir. She's present.
No, this is absentee list. That's the reason I'm deleting the name.
Chandrasekhar present, sir.
Amulya is present, sir.
Amulya is present. Okay, then
Sir, Chandrasekhar is present, sir.
Ankit is present.
Ankit Sharma.
Okay.
37.
Vivek was also.
Evangeline is present, sir.
Evangeline is present.
Yes, sir.
Next.
Chandrasekhar, sir.
Chandrasekhar, where he is?
sir.
He's there.
Present,
Fine.
sir.
Yes, sir.
Sir, Joshua Sanjay. Present.
Sir, Mohammed Shoaib.
Mohammed.
Karthik Jain present.
Wait. In this screen.
Sir Gagan ji.
Shoaib present, sir.
Wait, man. Yeah. So up to here, just I'm going to delete it. Just a moment.
J. Karthik.
Wait.
करण वर्मा सर
Yes, sir. Just one moment.
Coronavirus.
करण
Sir, Joshua Sanjay.
Even Karan Verma also supposed to be deleted, no?
yes sir
Yes, sir. Okay.
Sir, Joshua Sanjay present.
Hey,
Karthik.
Joshua,
Sir,
this is
Meena.
absentee list, man. That's the reason I'm deleting.
Sir, Meena
J.
also.
Karthik. J.
Meena
Karthik.
also.
D.
Okay.
Meena, sir.
Yeah, Meena's
Karthik
name also
G.
I'm deleting.
Sir,
J. Karthik. J. Karthik.
Karthik, huh?
sir
Hey.
Rajviraj sir there
Sir, Karthik D.
Wait. Hey, who is putting those dots, man? Delete that. Otherwise, I cannot able
Sir.
to.
sir Raj
Sir, Prajol, sir.
Raj Prajol
Sir, Jasmine is also
Roshan.
present.
Rashi, sir.
Raj also
Raj.
Chandan, sir.
Aslam bhai.
Sir, Aslam bhai present.
Gagan also.
sir Roshan
Ritu, sir.
Sir, Rashmi's wife.
Simon Rashmi is present.
Chandan.
Yeah, it is running out of time actually.
I don't know.
Make it
my
quickly.
class is-
sir take your time sir
Ritu, sir.
Sir, Rashmi is present, sir.
Rashmi is present, huh?
sir.
Gagan is present.
Sir, Sahana, sir. Sir, Mary Jasmine.
Sir,
Sir,
Mono
Ritu, sir.
Sir, absent.
किसकी जास्मिन किसकी जास्मिन मेरी जास्मिन योर जास्मिन
Sir, Sahana, sir.
Sir, Shoaib absent.
Sahana. Sir, Divya.
Sir, Rajesh point, sir.
Sir,
शिवानी प्रेजेंट सर
Sir, Sahana, sir.
Wait. Divya is present. Then
Sir, Gagan,
शिवानी
Sir, Mary Jasmine.
Mary Jasmine.
Ritu, sir.
Huh.
Sir, Trupti.
Sir, Gagan. Top, sir, Gagan.
Sir, Sahana.
Sahana
sir.
case. Okay.
Sir, Rajesh point, sir.
शिवानी सर
Ritu, sir. Sir, Ritu sir.
Grishma.
Sir, Gagan, top, sir, Gagan, sir.
Okay. Ritu is done. Then
tukda bhai.
Sir, number 6, sir, number 6.
Gagan. Okay.
Sir, 7, sir.
Karishma. Okay.
Ritik Jain present, sir. Sir, 4, Chandan.
In the second control.
नहीं रुके ना भैया भैया इधर रखिए अभी 2 मिनट खाना खा के आ जाएंगे इधर खाना किधर है
चल रहे बाहर भाई बंद कर रहे
Yeah.
Ritik Jain present, sir.
Sir.
Chandan. हाँ.
Ritik Jain absent.
Sir, Yogita.
नहीं गाड़ी इधर रख लो
Yes, yes, yes. Hey, wait, man. Next, Chandan is done. Anyone is left out?
Sir, me, sir.
Name it,
Sir.
please.
Yogita.
Yogita. Okay, ma.
Jain
Is done.
present, sir.
So everyone's attendance is done.
Sir,
Correct?
Ravi,
Huh?
Ravindra.
Ravindra is also present, huh? Okay.
Yeah, he is there, sir.
सर विनय मिश्रा सर
Hey, Vinay, your name is there?
विनय मिश्रा
Vinay Mishra's name supposed to be added here, huh?
Sir, Vicky Sharma, sir.
Vicky Sharma, okay.
Vicky Sharma absent.
Hey,
Ritik Jain present, sir. Ritik Jain
sir,
absent,
your
sir.
name supposed to be added here.
सर विनय
Vinay's name supposed to be added
Ritik
here.
Jain present.
Yes, sir. Is it done? Everyone's name?
It's
Thank you. You can log out and complete that assignment.
thank you, so.
Sir,
Yes, sir.
Rashish and Rashmi also, sir.
Sir, already submitted assignment.
Yes, sir. Fine. Rashish and
Sir,
Rashmi, where?
Rashmi also, sir. Her mic is not working.
It's okay.
Sarfraz.
Rashmi's name, whether Rashmi's name is
Sarfraz.
getting reflected.
No, sir, she's absent.
सरफराज रे राजेश
Sir, Pooja Vai is also presented actually.
Yeah,
Sir,
sir.
Sarfraz.
They're all present, sir.
Pooja, why is
प्रेजेंट
huh?
प्रेजेंट
Yes, sir. She's present.
निकाल दिया नाम मेरा सर
Sir, Mamesh down.
आई एम प्रेजेंट
Sir, Vicky Sharma absent.
Is that done?
Aslam bhai.
Is it over?
Sir, Mamesh is present, sir.
Where he is?
Event, sir, event.
Shoaib, don't say unwanted names.
So it is done. Correct? Okay. Thank you.